Hi, my name is Frank, and I started a YouTube channel. As an emergency medicine physician, I want to try to accomplish several different things. I want to try to provide some insight into how healthcare professionals see the world in somewhat of a different light. I also want to provide an outlet or catharsis for myself, because I've got a lot of stories to share if you're willing to listen. And hopefully along the way, I can provide some level of entertainment. Now I'm going to be totally honest and extremely frank. This is my channel. Hi. On this episode of Extremely Frank, I've invited a guest to share some of their interesting experiences they've had while they were in the emergency department. Now, I want to apologize ahead of time because we had some issues with his mic, but I think you're still going to enjoy what he has to share with us. So having said that, let's get started. I have a guest today with me, and we have Dr. Chris Krawczyk. And so what we're going to talk about today, Chris, is we're going to talk about anything you wanted to tell me about, like any funny stories that happened or any crazy cases you may have seen while you were working in emergency departments back in the day. So anything come to mind?
Well, first of all, Frank, thanks for having me on your taping here. I'm glad to be here. I'm glad to see you and hang out with you. And we've had some good times back in the emergency room at our old hospital, and there was a lot of good times. There was a lot of funny times, and there was a lot of crazy patients that we took care of. And I really cherish some of those times as part of my emergency medicine career. So I know you asked me to think of some cases, like what has happened to me, like specifically, like this is a very unique career, the jobs we chose it's just very unique, and you see people at their best and their worst and when they're acting absolutely crazy. And if you could dream it up, somewhere in some emergency room around the world, someone has probably seen that. And it's really very unusual. It's an unusual career and profession. So, I thought up one of my most recent cases that I saw at a hospital that I'm currently working at. And this hospital has a psychiatric department, so we see a lot of psychiatric patients. And this person was being admitted to our psychiatric unit for decompensation of her bipolar condition. And, a lot of times, as you know from dealing with psychiatric patients, they're a little bit, they can be unruly at times, and they often need medication to calm them down. But a lot of times they can also be cooperative, and they understand some of their illness depending on what kind of patient they are. This particular lady that I'm thinking of, she was somewhat uncooperative, but then decided she wanted to be cooperative, and she understood that she needed help and she needed to be admitted to the hospital. And in general, she was accepting that she was going to come in for an evaluation and get proper treatment. And we're glad about that. We're always glad that when we see someone who's sick, I think mental illness is awful, especially working at this current job. I see it a lot, and it's distressing and sad to me. It probably is one of the worst things that could have happen if your mind is completely out of control. So this particular lady, she was doing well. She stayed there overnight. We had to hold her in the emergency room because we were waiting for a bed. So we were giving her meals. We were giving her medication, so everything remained stable. So during our mid-afternoon, we had a little bit of a rush. We had some patients that came in that needed more attention. There was 3 patients that came in, all very close chronologically. One person was short of breath and needed immediate attention. There was another person that had chest pain that required EKG and quick workup. And there was a third person, I'm not sure what it was. I think it was someone who was older, bordering on septic, needed some, more rapid attention so we could get all of our times in order. And during all this, we're scurrying around the emergency room and, attending these patients. And this lady that we were admitting for the bipolar disorder, she just decided that she was going to take off all of her clothes, right down to no socks, nothing on, right in her bare naked self. And she just took a walk around the emergency room. And, number one, after it all happened, we're all laughing and thinking about it. But first of all, there's no other profession that you're going to see something as unusual as that. You're not going to be walking
Right.
around the grocery store or at the bank and have someone just come in walking around naked. It's just very unusual. But in the emergency room, we're used to seeing, drastic and crazy things, and people have sort of developed a certain control of certain emotions, and you don't want to overreact to a situation. And it was very funny because we see a lot of psychiatric patients at this facility that do weird things, and this lady was just walking around, and everyone was just looking at her and like, hey, that lady's walking around naked.
Like it was just totally normal.
Like it was just, it was like one of the housekeepers mopping the floor. And so, the nurse just went over to her and she's like, hey, what are you doing? And the lady was like, just getting some fresh air out of my room. And it was just as simple as that we're treating as like some normal occurrence. And we just directed her back to back to her room in the emergency room. And said, we have patients here, and there's other people, there's children walking around, there's children that are present, and it's probably better if you just go to your room. And she did. She went back to her room, and we got her, something to eat, and that was it. She put her gown back on, and we moved on with the rest of our patients. But it would be unusual, I think, if someone walked into the grocery store buck naked. People would be like, "What are you doing? This is crazy."
And it does sometimes happen in the real world. And in this next example, I'm going to show you how the public sometimes reacts a little bit differently than how would we react when we see someone naked running around, as this example will show.
Within seconds of the man stripping down and pouring bleach all over himself, San Bernardino police say Stater Brothers employees and the store's hired security tased the man to try to contain him.
So we're a little bit more accustomed to this situation than most, just by the very fact that we see these situations a little bit more frequently. So we handle it differently than the public. Otherwise, we might be tasing 20 to 30% of our population, which we don't, thank goodness. So let's continue on with the interview.
But in this situation, we're trained for these odd occurrences, or not necessarily trained, but accustomed to it. And it was just funny the way it was handled, that it really didn't ruffle anyone's feathers.
Yeah, I think it sounds like, I think when I think about it, we've become somewhat desensitized,
I think that's right. That's right.
I think when I first started my training, if I had seen it as a medical student, I'd be like, oh my gosh, and I'd be freaking out. But now, having worked in the department for years and seeing all these crazy things, now, like, it doesn't faze me at all. And I would say probably the same thing, like, you probably feel the same way, like, certain smells now. Like,
yes.
I used to, like, dry heave when I was younger, when I smelled something that was obviously not pleasant. And now I can smell almost anything, and nothing phases me now, whether it's at home or at work. I mean, even the worst smells, I'm like, and everyone around me is dry heaving or walking away, but I'm like, it reminds me, this is a crazy story. This is at one of the hospitals we used to work at. So What happened was, I came to the department one day, and I started my shift, and about an hour later, a patient was brought in by ambulance, and they put it in one of the rooms. And our rooms at the hospital, you remember, they have this glass door. So, I mean, it's pretty self-contained. It's not with curtains. I mean, it was a pretty good self-contained room. But within 15, 20 minutes, the whole department started to smell like something. Now, I am used to a lot of smells, but this smelled like, honestly, one of the worst smells I've ever had was like a rotting flesh-like smell. And, of course, I was the physician on that day, so I had to go see the patient. And I walk in to see the patient, and you can't tell anything. It's a patient that's somewhat obese, but it has a gown on, so you can't tell. And I go and I start examining the patient. And then as I'm examining the patient, checking their heart and their lung, make sure everything's stable, then I go to look at their extremities. And what I do is I lift up part of their gown and look at their legs. And this happened to be an elderly female. And as I lifted the legs, this lady had what we call, elephantitis. The skin was super thick. It was overgrown, and there was literally, when I lifted this gown, thousands of maggots were crawling and infested her skin and her legs. And I have to tell you, most people have seen maggots before. And when I see them, if you see them in the garbage, they're small, they're white, they look like they're crawling slowly, right? I mean, they don't look they're very fast. But when I lifted up this person's leg to examine the whole leg, The minute I lifted it up, first of all, like hundreds of maggots fell to the ground because there were so many.
Oh my gosh.
The leg was cavernous because they had eaten through the dead tissue, so they had lots of little tunnels all around. But the thing I didn't realize is that maggots are really fast, and maggots really are fast. And if you're somewhat queasy about maggots, please fast forward the next 8 seconds as I show a brief demonstration about their speed. When I lifted the legs, you could see the maggots scurrying around quickly through these caves that they had burrowed. It was one of the worst smelling and worst cases I've seen in my life. And that day, I actually had to admit it to the on-call surgeon who had to take care of this. They had to breed or take away the dead skin and obviously kill all the maggots. And I remember calling the surgeon on call that day, and he was obviously very upset because this was a case, it's an unreferred case, and he's going to have this awful case. And he told me after he took the patient to the operating room that it took him like a long time to breed or take all the dead skin and then clean it all off. But he was really mad. Like, he was kind of transferring his anger to me because I had nothing to do with it, but he was just mad. He was letting me have it. And wouldn't you know it, 1 week later, now I have never seen a case in like year. I've never seen any case. I've only seen twice in my life. And the second time I saw it was a week later. Oh, unrelated. And guess who the surgeon was on call that day? The same person. And he was awesome. Screaming at me. But I mean, that's a crazy, you just kind of reminded me, but that was a crazy, crazy story about like the smells that we get kind of used to it. And that one I couldn't get used to though. What else? I mean, you must have seen some other things too here.
You know, this is one case that I was thinking of. This was again in our old hospital that we used to work at. And this was a story of a young lady who came in with her parents. She's a senior in high school. She was 18 years old. And she was very confused that she was acting crazy. And she had gone to her senior class night or day, the day before. And the mother said she was just acting pretty strange. And so we get her into the room and we start evaluating her. And she's just a little bit off. She's not acting normally. And so, I asked her if she's used any drugs or anything. She's a senior in high school. People do that sort of thing in high school, as you probably know, for your own kids being in high school, right? That, you hear them talk about people that are doing things that probably they shouldn't be doing. And you know what? And I asked the patient, and she said, no, I don't do any of that. And then I asked the mom, I said, is she a good student? Is she, does she get into trouble? And the mother said that she's the top of her class. She's her class valedictorian. She is extremely bright. She's very motivated, and she's never done anything like this. And we don't know what's wrong with her. So she was just acting so weird that the only thing I could think of is, she's on drugs. What else could it be, right? That's the first thing I think of. So she can't really give us a good history, and the mom gave us as much history as she could. And so we do an evaluation on her, and during her time in the emergency room, her behavior and her mentation starts to really degrade. She starts acting really abnormally, and at one point she started screaming and just completely like getting out of the bed, laying on the floor, moving all around. And it was bizarre behavior. So we gave her some medication, and that seemed to settle her. So at least she was not getting out of the bed. She was still, screaming out and just acting bizarre and abnormal. So she's definitely starting to decompensate. So, and all of her workup kept coming back as negative. So we did a CAT scan, we did everything. And, the last thing that I'm thinking, I'm like, does she have meningitis or some sort of encephalitis? So and this is where it got the case became more interesting than usual, is that she wasn't cooperating she wouldn't cooperate for that test. That's a procedure that, as you know, in this case, of this patient, she would have to be in a lateral recumbent position, and you need to have a steady hand, and you have to get the needle right in the right place. And so what I wound up having to do is intubating her. to completely sedate her. So I intubated her, put her on a ventilator. We got her on a side in a good position. And fortunately, I performed a spinal tap with no complications.
Now, a spinal tap is where we take a long needle, probably about 5 to 6 inches long, and we insert it into someone's low part of their back, into the spinal canal, so we can obtain some fluid to test out to see if someone has an infection or why they may be altered. But we do need the person to be somewhat cooperative, or at least holding still, because we don't want that needle to go somewhere where it shouldn't go.
And the fluid looked clear, and I remember the fluid came back. I can't remember the exact results, but it wasn't, she didn't have like bacterial meningitis. She didn't have anything that looked overly unusual. It was an interesting case. So we admitted her to the ICU, and that was it. And then, the bad part of the emergency room is you don't really have good follow-up. You don't really know what happens unless you specifically hunt down the results. And since it was at her hospital, I checked in to see what was happening like a few days later. And as it turned out, she was seen by the infectious diseases person, and she apparently had Lyme encephalitis.
Wow.
Very interesting case. So they gave her treatment. She was extubated the next day, the next morning, and she was still acting unusual. They gave her treatment, and she resolved. And so a week after, she was in the hospital for the better part of a week. And then she was able to give her class commencement speech in the middle of the following next week. And it was just an interesting case because it was so bizarre. It was complicated. It took you out of your comfort zone of usual diagnoses. It shows the value of taking a very good history, because I guess travel history wasn't one of the things that it popped into my mind initially. But it had turned out they had visited some relatives in North Carolina a few weeks earlier, and likely she was bitten by a tick. And it was an interesting case, though. So I do appreciate these interesting cases. And of course, she was seen by the infectious diseases doctor. So, and those people take a history all the way back to your birth history, and those guys are very good at what they do. And it was an interesting case. So this is something that fascinates me.
That's great.
Interesting medicine, yeah. What about you? Any interesting cases? Any juicy ones?
Well, I there's a couple, but the one case that there's a couple of cases, but I'll share just one here today. I remember early on in my career, I walked into the department, and this is a crazy case. I walked in, and this wasn't my case, but I started getting involved in it. I walk in, and I see out of the corner of my eye one of the patients that needs to be seen. And it's a young male that's probably in his early 30s. And he has a 6-foot lead pipe sticking out of the back of his left eye socket.
Oh my gosh.
He's lying on the stretcher, and there's a pipe just sticking out. Yeah. And he was still alive. And so obviously our main goal is to stabilize. And this is where it becomes tricky, because you have to get the airway, but there's a pipe in the way. The pipe's obstructing it. You have to get everything else, what's going on. But outside this, the crazy part of the story is we end up getting stabilized, and he goes to the operating room, but he ends up unfortunately passing away. But the crazy part of the story is that we wanted to find out how this happened. How does a 6-foot lead pipe end up in his left eye socket? So we interviewed, and we got the history, and it turns out what ended up happening is that he was drunk that night. But what happened was, he came home after a night of partying and going out and doing things he probably shouldn't have done. And his girlfriend came home and found out that he was cheating on her. And so because of that, while he was sleeping, she got on top of the bed and took a lead pipe and shoved it through his eye socket. So
that's awful.
It just goes to show you that hell has no fury like a woman scorned.
I guess you're right. That is crazy. Holy cow.
Yeah, that's the crazy part of the story.
That's awful.
Yeah, I mean, the rest of it is not as interesting. Like I said, the gentleman ended up unfortunately passing away. There was obviously a lot of trauma, but the backstory was just absolutely insane. So
that is really crazy. I could share a trauma story too, because what ER story wouldn't be complete without throwing some trauma in. But this is my senior year of residency when we were rotating at our local trauma center. And it was funny, it was my last week of residency, and you're looking at all these procedures that you should have collected over 3 years. And on the list was open thoracotomy, right? And like,
So I have to stop the video here for 1 second to explain what a thoracotomy is. That's when we make an incision on the side of the body to split open the ribs so we get access to the chest cavity, usually to the heart or the aorta or some other part. It's a pretty last-ditch effort because it's a pretty traumatic procedure.
we don't really even perform those really that much anymore. There's very specific indications. And so it's my last shift, and they bring in a patient with a single gunshot wound to the left chest who lost vital signs en route to the hospital. And so we had the trauma team there standing by, and it was happened to be a guy who I had done trauma rotations before. And we did an open thoracotomy in the emergency room. And so I happened to be being the ER resident, and he being the surgeon. He made the incision, put the spreaders in, got the chest wall open on the left side. And I wound up performing manual cardiac massage on this patient while my resident friend was in there digging around trying to find the bleeding and trying to clamp whatever was there to get the patient to the emergency room. So he's a cardiac arrest. We're trying to get him stabilized just to get the bleeding to stop where it was coming from. And I'll say this, he was given a lot of IV fluid. So when he made that first incision and we started working in there, blood and IV fluids were just pouring, literally pouring out of his chest wall, onto the cart, onto the bed, onto the floor. It was splashing. It was something, crazy. I've never seen this before. And so we're doing a manual cardiac massage, and the long story short is they never took him to the operating room because we couldn't stabilize him, and he just died in the emergency room. And I just remember taking off my gown, my face mask, and I mean, from the blood splashing on the floor, the bottom, I would say from my mid-thighs down to the floor were just saturated in blood.
Oh, God.
I had blood all over me, and I walk out of this trauma room, and it's my last case of the day, my last case of residency, my last case of my resident career, and my last case of the day. And I just stood there. Someone got me some new scrubs. I washed up and went home and called it a residency. But I got that procedure. Open thoracotomy. I guess I was there for it. I didn't specifically perform it, but I saw it right in front of me, and it was probably the most dramatic trauma case that I saw while I was in residency. There was a lot, but that's one that really sticks in my mind just because it was so well timed at the end of my residency on my last shift, and coming at the heels of another crazy case they had. So
you probably haven't done a thoracotomy since.
No, that's the last time I've seen one or participated in one.
Yeah, I mean those are brutal, obviously.
Yeah.
Has there been any times where anything that's kind of been weird or funny that's happened because you outside the department, because anything like that?
Like in the context of emergency medicine?
Well, I mean, just by the very fact that you're a physician or something, just because you're a physician and outside the department, has something happened because of that? Someone knew you were a physician or something like that, or?
I don't know if anything funny has happened, but I definitely responded to immediate emergencies, which I've had actually 2 very serious ones in my life, which is just a case of being in the right place at the right time. This was a few summers ago, and this was, I live on Grand Island, and they have an annual air show. It's an amateur, or I don't know if you would call it amateur, but it's a private small plane air show. Someone has a grass airstrip, and they have this, I don't know, it's almost like a fair or an event of some sort of a field day where people fly their planes in. The person who owns the air show has serves food, and they have skydiving event, and they have different things that they do there, and it's very entertaining. It's interesting to see different planes and people talking about planes, and they have an announcer talking about planes. So it's a pretty cool scenario. So the fire department was standing by, like they usually do for most island events. And so during the skydiving, one of these skydivers is coming down, and it was a windy day that day, and honestly, they were talking about not doing the skydiving, but they decided to do it. And these 2 skydivers came down, both experienced, right? And the first guy came down, and like it was a beautiful descent. You know, he came right down and he dialed it right into the wind. And as he descended, he just literally landed on the ground with both of his feet and just walked right out of his parachute. And the other guy who was coming down with him was fairly close behind, and you could see he was coming down at a much faster rate of descent and a much steeper angle. And as we were watching it, we're like, oh my goodness, he's coming in pretty fast. And he went down extremely hard. Like he hit a plane and he went down and he just crumpled. And
he hit a plane?
There was a plane. All the planes were parked along.
Oh, God.
The planes were on the ground. So he struck the wing of a plane and he went down to the ground. So we're all standing by. I'm standing there as a spectator, not as a fire department medical director or like a medical person. And I'm with my son, who I don't know how old he was. He was definitely younger than he is now, and probably someone who shouldn't have seen what he saw. But we sprinted across this airfield, and I happened to be at a decent angle. Like I was like the second or third person to get there, and clearly the guy was very badly injured. He had bilateral open tib-fib fractures. He was pouring blood out of his mouth, and he was unconscious. And so, you know, the paramedics were right behind me. We went to work, and fortunately it was one of our very seasoned paramedics. There's another paramedic there. So we got an IV line in we got the guy intubated. Remarkably, this paramedic, who's very well seasoned, he got the endotracheal tube in. The guy's pouring out blood out of his mouth. Turns out he has an open jaw fracture inside his mouth.
Oh, God.
And he was definitely shocky. So, you know, I sort of managed like the resuscitation end of it. He managed the airway. We had the other paramedic who was working on like just assembling things, getting things situated. And he was mercy flighted out of the area. And that guy actually lived, but I think he's grateful to be alive.
Yeah, that's a great story. I mean, I'm sure there's lots of people out there in the medical professions that have been able to offer their services because they were there at the right time. I mean, I've had a couple, but I'll save that for another episode. I will tell you one of the things that's somewhat unrelated. I didn't save anyone's life, but I will tell you something that was funny that happened to me. And I think I was going to ask you this. So having worked in, you know, before I became an emergency room physician, I was always really good with names and faces. Always really good. So if I met someone and the name, I could always remember it. But then once I started working, it's like my hard drive would not even start recording anyone's names or faces because we're seeing so many people.
Yeah, you're right.
All the time now, because like I can't. Initially, I would remember, but like after the first month, you've seen hundreds of people, so your brain can't process names and faces anymore like it used to because I'm seeing so many faces and so many names now. Early in my career, I was off and I was at the mall with my wife and a couple of friends. And we were at the mall and we were walking through the entrance, and all of a sudden this young, attractive female, like she sees me and her eyes light up and she goes, Dr. Lee, Dr. Lee. Now, whenever someone calls my name, I don't know how it feels with you, but whenever someone calls your name out and you don't recognize them, there's like a moment of panic.
Yes, you're right. You're like, oh my gosh, I know you from somewhere. Yeah, you're right.
Right, you're trying to figure out, how do I know this person? Where do I know this person? And plus, I'm with my wife, and this young, attractive female is running towards me with her arms open.
Oh my gosh.
So she runs to me, and she could see that I had a blank stare. Like I could not recall how we had known each other. I really couldn't. I was sweating. I was trying to think, how does she know me? So she goes, oh, Dr. Lee, you don't remember, do you? And I'm like, I apologize. I'm sorry. And my friends are with me and my wife's, and like, I'm sorry. I really don't remember. It's like, oh, well, you remember, but you treated me for gonorrhea in the hospital when I came to the ER that one day. And I'm totally like, I don't even know what to say at that point in time. I'm not sure why she had to reveal that. She could have just said I treated her, but she kind of like told me exact. And I said, well, it's nice to see you again. And then we walked on our way. But like I said, my whole group of people with me, they were also in shock too. But that's kind of a funny story. because like I said, I could not remember. Like I said, I stopped remembering people's faces and names. I used to be able very good, but like I said, I think it's just because of we've seen so many. But that's kind of a funny story. That
Yeah, that's awesome, right? Oh my gosh,
it wasn't awesome at the moment.
I mean, awesome. It's awesomely funny, maybe. Just, but you know, like it's just funny how what people do. You never know what people are going to do.
I think when she was obviously, she was obviously grateful for being treated, but
course, yeah.
like I said, she could have just said that I had seen her.
That's right. That's right. Oh my gosh.
All right, so Chris, it's been a pleasure having you today. I mean, I think it's always great to share some of these stories. We'll have some other episodes on as well. I might bring you on as well. Tell me some of those other stories you have. But I want to thank Dr. Chris Krawczyk for coming in and being part of this episode of my vlog. So thank you, Chris.
Thanks a lot, Frank. It was great to see you, buddy. Good to chat about the old days.
Yes, absolutely. We'll do it again. Well, I hope you enjoyed this episode of Extremely Frank. A special thank goes out to Chris Krawczyk for spending some time with us and sharing his experience. If you did enjoy this, please like and subscribe. And if you want to hear any new topics or hear someone else specifically, please let me know in the comments below. I'll see you in the next episode.